Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The mounting is to verify to see if you've mounted correctly to this centric registration. And you do that by loosening the screw on the top of the articulator, which allows you to open the articulator. This top member of the articulator, you seat the maxillary cast in that bite firmly, and then tighten the screw on the articulator to see if it pulls it out of the bite. If the tightening of the screw on the top of the articulator pulls the teeth out of the centric registration, then you have mounted incorrectly to this centric registration. And you should just remove the mandibular cast and remount to that same registration. However, if that registration is correct in the mounting, we would want to record or see if we have the same contacts on the articulator as we have in the mouth. First thing you would want to do is to get rid of the incisal pin so that we can close the articulator now and get the teeth in contact. Remove the centric registration, and now we would want to tap these teeth together in centric relation and see where the first contacts are occurring. So you've got to hold the articulator in centric relation. Make sure that you're holding it downward forward as you put your hand on the back of the articulator, as you see here, holding it down and forward in centric relation. Don't let it slide. If the teeth come together and slide, then you're not going to record the first contacts. Using a strip of 28 gauge green wax, we would like to put this between the teeth and hold the articulator in centric relation, bring it down and tap a couple of times to see where the contacts are occurring. Now don't tap too hard, or you'll find that you will penetrate more than you will in the mouth. But you can see we've got some penetrations in the wax here, and we want to set that aside so that when we go to the mouth, we can compare that with the mouth. Now that was the right side, so we'll put an R on that one so we can tell that when we go to the mouth. Taking another strip of wax on the opposite side, place it between the teeth, holding the articulator in centric relation. We want to bring it together, don't let the articulator slide, and we tap it a couple of times with a light contact. And we can see here the contacts that we're getting on the left side. And these will be the contacts that we're comparing when we go to the mouth. We see some heavy indentations here, here, and fairly uniform along this side. So we want to go to the patient now, arcing the patient in centric relation, holding them back in centric relation. We want to put some wax between the teeth and see if we have the same contacts on the articulator as we have in the mouth. We now want to go to the patient, have the patient opening and closing on the terminal hinge movement, and we want to see if we get the same contacts or tendency for contacts in the mouth as we did in the patient. So you go back to the mouth, practice with the patient closing, close on your fingers, rub forward please, forward and back, forward and back. And when the patient's back, you bring him down to the first contact and tap, tap a couple of times. Okay, open please, just hold your jaw like that. Then we take a strip of the 28 gauge green wax, the same as we did on the articulator. We put that on the teeth, put that in the mouth with the patient arcing on the hinge. Now it's hard to do this in the mouth without getting a skid, so you want the patient to come down to those first contacts. Open just a little bit, please. First contacts, tap, 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 about the same way as we did on the articulator. Open, please. And we should have indentations in the wax that we can see here. We take the one that we have from the articulator and we start comparing the indentations. You see here we have a light one here, 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 and here. So that is a pretty good indication that we have, on that side anyway, the same tendency toward contact as we did in the mouth. The heavy one here is in the bicuspid area on that side. So we do the same thing with the opposite side. Taking another sheet of green wax, place it between the teeth, get the patient back in the centric relation, terminal hinge closure. Open just a little bit, please. Bring the teeth down. We want to tap, tap a couple of times the same way as we did on the articulator. Open. Trying to get about the same indentations as we did on the articulator. There's more of a tendency to skid in the patient than it is on the articulator because it's hard to hold the patient back into centric relation. And now we compare the tendencies toward contact. We have here, here. This isn't quite as good as it could be. There is a little bit of skidding there, but we still get the same heavy contacts here as we did in the mouth. So we can be sure that the closure or the contacts in the mouth are the same as we have on the articulator. Let's see what kind of a skid we do get with this patient closing. Now bring your jaw forward, please, Rob. Back, forward, back. Now bring it down to the first contact, the very first contact. Very first contact. Notice the midline. Now watch the midline as she squeezes. Squeeze, please. Open. Let's try that again. Bring it down to the first contact, the absolutely first contact. Now squeeze. Okay, there's a good indication there. Open, please. Way in the back. Close down to first contact. Squeeze. Good. Where do you feel the first contact?
I think over here.
On this side?
Yeah.
Patient seems to feel the first contact on this side, and that appeared to be the heavy contact that we have in the wax. So we verified the mounting now, and we are sure that we have mounted the cast correctly on the articulator. To set the whip mix articulator, it is recommended that we use 2 lateral checkbites. We will set the condylar inclination and the bended angle from the lateral checkbite. We set the bended angle from the checkbite, and this is why we use 2 lateral checkbites instead of a protrusive checkbite as we do on other articulators. You'll have to remember that maybe the condylar inclination will be a little bit higher using the lateral checkbites than it would be if we used a 2 lateral ones, or be higher if we used the 2 lateral ones than if we took 1 protrusive. But anyway, we can use the 2 lateral checkbites and wind up with a satisfactory setting. If you want to take a protrusive checkbite, you can do this also. The best thing to do with taking the lateral checkbite is to practice with the patient. So we would practice with the patient in the closure that we want him to make. The difficulty in taking the lateral checkbite, again, is to make sure that the working condyle, the rotating condyle, does not come forward. So we should start with the patient. We're going to have the patient open to make room for the wax. We want to make sure that the patient gets back, and then they start to close a little bit. Now come over to this side and close. And that's the way you want the patient to close, with the wax in between there. Make sure that you feel. You'll have to remember that maybe the condylar inclination will be a little bit higher using the lateral checkbites than it would be if we used a 2 lateral ones, or be higher if we use the 2 lateral ones than if we took 1 protrusive. But anyway, we can use the 2 lateral checkbites and wind up with a satisfactory setting. If you want to take a protrusive checkbite, you can do this also. The best thing to do with taking the lateral checkbite is to practice with the patient. So we would practice with the patient in the closure that we want him to make. The difficulty in taking the lateral checkbite, again, is to make sure that the working condyle, the rotating condyle, does not come forward. So we should start with the patient. We're going to have the patient open to make room for the wax. We want to make sure that the patient gets back, and then they start to close a little bit. Now come over to this side and close. And that's the way you want the patient to close, with the wax in between there. Make sure that you feel that the working condyle does not come forward, because if it comes forward and you go over to the articulator and try to set it, the check bite won't fit in the articulator. So we have the patient, we will stick the wax on the mandibular teeth, start with the patient back in centric relation, come to this side, and close into the wax. Okay, back. And this is the way we would take it. Now you have to come laterally quite a ways. The wax you would use for this is a regular pink base plate wax. Estimate the thickness or the length of this. It would be about the length of the occlusal surfaces of the teeth. We want to have a little more wax when we take the centric relation registration than we had for, taking the lateral than we did for the centric relation registration, because the teeth are going to be separated further. So we warm this in wax, we roll it up, having it about the width of the occlusal surfaces of the teeth. If you get too much wax in there again, you're going to find it hard to work with. So if we roll this up about the width of the occlusal surfaces of the teeth, this is all we need. If you've got a mandibular cast handy there, go ahead and adapt this in a horseshoe so that you can go to the mouth, lay this on the mandibular teeth, and take the registration. Don't have any contact in the tissue. You don't want the wax to contact the tissue. So once we have the shape of this wax rim, have 3 or 4 thicknesses of wax, we are ready to go ahead and take our registration. We would put this back in the water or on a flame, soften the wax sufficiently. We go over to the patient, have the patient open. We lay this on the mandibular teeth. You can press it a little bit against the mandibular teeth if you want to help hold it in place. And then we start our procedure of working with the patient. With the jaw way back, we start closing, come over to this side, now close. Good. Now you've got to make sure that that working condyle, squeeze just a little bit more. Make sure that the working condyle did not come forward. And you notice the amount that we've moved over here. We've moved almost the width of the centrals, or 3/4 of the width of the maxillary central, which should give us enough to move the condyle out of the fossa for setting the articulator. And this is one of the difficulties in using the lateral bite with the whip mix, is to get out laterally enough with our registration and to have the working condyle staying back in that position. Open, please. Now we can take this out. Now it's stuck to the maxillary teeth. Close. Open, come to this side a little bit. Okay, close right into it. If it gets stuck to the teeth, then hold it against the mandibular teeth and have her open. Open, please. And then you don't warp the registration. Take that out of the mouth. We can make sure that it fits on the mandibular cast again. And we can chill this, and that is our left or our right working movement. We have another registration already made. We can throw this in the water and warm this up so that we can take the registration. It's well again to go back and practice with the patient. Close back there. We're going to move over to that side. Place the wax in there on the teeth. Get the patient back into centric relation. Move over to that side. A little bit more, a little bit more. Start closing, please. Move over that side just a little bit more. All right, close right down now. Bite right down. Make sure that the jaw doesn't come out. This condyle stays in its centric relation position, and we have the patient closed. Now open, please. Again, about the width of the maxillary central if possible. And we have the bite. You notice here that we just have the lingual cusp, but that should be sufficient enough to set the articulator. So now we have our 2 lateral check bites. We can now go to the articulator and use these to set the condylar inclination and the Bennett shift on the articulator. We can now use the two lateral check bites that we've taken to set the articulator. The incisal pin should be removed from the articulator. The posterior condylar inclination we've had set up at 30 up till now. This should be set at 0 on both sides. And the Bennett guide, or the Bennett angle, should be open fully. Do that for both sides of the articulator. We can now go ahead and put our one lateral registration in the articulator. And seat the upper and lower cast firmly in the registration. It is easier to set the articulator now if we turn it upside down, and we can see where the condylar balls are in relationship to the fossa elements. Looking at the working side first, this condylar ball must be against the posterior wall, as you can see here. We don't want that to come forward. We want that against the posterior wall, and it should also rest against the superior wall. It should rest in this position as we hold the teeth firmly in the centric, or the lateral registration. So if we look here, we can use a firm pressure on the articulator and hold the cast firmly in the centric registration, and the ball should be against the fossa on the working side. If we look at the orbiting side or the balancing side, this condyle should have come away from the back wall, as you see here, come away from the posterior wall. If you don't have this down or away from that wall far enough, you won't be able to set the inclination. And you notice it is also away from the top wall. There's a space between the condyle ball and the superior wall. So now the way we set the articulator, all we do is to rotate the superior wall or the condylar inclination. We just rotate that until it touches the ball. You see, if we go too far, we raise the ball away from the articulator. So with that in that position, I want to tilt it till it touches, and then we tighten the screw under the articulator. And that is all is necessary for setting the condylar inclination. We have now tilted this superior wall until it touches the ball. And that's all there is to setting that. Now we need to adjust for the lateral guidance, the Bennett angle. You will notice with the Bennett guide set way at a wide angle, you can see that it does not touch the condylar ball again. As you see here, it does not touch the condylar ball. So what we want to do now is to merely move this lateral guide or the Bennett angle in until it touches the ball, as you see here. And that's all there is to setting the Bennett angle. And then we tighten the screw on the top of the articulator. So with those two movements, those two adjustments, we have set the condylar inclination and the Bennett angle. And that's all we would need for that side. We could now go ahead, put the other lateral registration in there, and do the same thing for the opposite side. So we take that one out, put the other one in, we turn it upside down now, and we make sure that the working condyle is against the ball. Now the working condyle would be the side that we've already set. This side here, we will want to see that that does not come away from the posterior wall. The ball should be resting against that wall. If this comes out or it jacks is against the superior wall too far, then your teeth won't fit into the registration. So you'll have to discard a lateral registration if the working condyle is not against the ball. Now we go over to the opposite side, and that condyle should have come down and forward. So holding the articulator so that the condyle is in the teeth are seated well in the wax bite, we notice here that the condyle has come down and forward. Now we took these lateral bites with the patient moving quite a ways in the lateral movement, but yet you can see the slight difference that we have here. So you're going to have that patient come out laterally quite a ways. Now if we look at the ball, it is away from the superior wall. It's away from the superior wall also. And now all we do is to tilt this condylar inclination so that it touches the ball. If you tilt it too high, you're going to raise the ball off the table. So you tilt it up until it just touches. We tighten the screw for the condylar inclination setting on the underside of the articulator, and we have that set. Then we take the lateral guide, we move that over until it touches the condylar ball again, and as soon as it touches, we tighten the screw on the underside of the articulator, and we have the articulator set. We have our protrusive and our bended angles set on the articulator. Now once these are set, we can go ahead then and use the articulator with these settings to analyze the interferences that we have between centric relation and centric occlusion on the cast. We could simulate the slide that we had in the patient's mouth. If you remember the patient when we closed into centric relation and the patient would squeeze, we would have a slide in the teeth. And this should be somewhat the same slide as that patient had in their mouth. Come down to the first contact and squeeze, and you look at the slide. And then we can use the lateral settings that we have to analyze the interferences in lateral movements. And we have a set of casts mounted on an articulator that we can use to analyze the occlusion.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.